The kneecap, instead of it rubbing a smooth surface against a smooth surface, it's rubbing side to side, and so these are rough edges out here, and that's what's causing that discomfort, that pain, that problem, that grinding, etc. It traditionally starts out though as a stiffness and a soreness. You traditionally will have a fair amount or a lot of tightness in muscles coming down the back of your legs, your hamstrings, or in your calf muscles, or in your hip flexor muscles in the front of your thigh, or in your quadricep muscles. And if any one of those muscles or a combination of them is too tight, meaning that they don't stretch out the way that they should, then instead of the kneecap rubbing gently, it's actually being pushed harder against that groove at the same time that it's moving side to side. And so these rough edges are actually pinching on the backside of the kneecap, and that's why it progressively gets more uncomfortable and more painful. So again, a patellofemoral pain problem or a knee problem is really caused by two things: weakness in muscles in your glutes and the outside of your hip, and weakness in your quadricep muscles, mostly your vastus medialis, the muscle along the inside of the leg. That muscle's job on the inside of the leg is to keep that kneecap pulled inward so that it doesn't get pulled out over this ridge, which is what allows it to bump side to side. When that weakness starts to set in, you'll start to get some protective tightening in your hamstrings, your calf, your quads, your hip flexors, and when those muscles get tight, they jam that bone back against the groove, and that's what really starts to cause the popping and the grinding. So what can we do to prevent that? Well, the biggest thing that needs to happen is somebody needs to evaluate your entire leg, and that's really where an expert physical therapist at Loudoun Sports Therapy Center comes into play. Somebody needs to evaluate what's happening at your hip and your pelvis, what's happening at these muscles, what muscles are tight, what muscles are weak, what happens at your knee when you walk, does it cave in? Somebody needs to be able to look at what your kneecap is doing when you bend and straighten your knee. Somebody needs to look at your calf and your lower leg, what your foot does when your foot hits the ground, and put all of those things together, because that's what's really going to fix this knee pain or this patellofemoral pain. Simply doing some stretching, not going to fix it. Simply doing some strengthening, not going to fix it. Simply combining both of those and doing strengthening and stretching, not going to fix it if we don't stop that kneecap from moving side to side. And that's really where an expert physical therapist at Loudoun Sports Therapy Center comes into play. So if you're having any knee problems, understand stiffness, soreness, tightness, or if it's gotten to a point where going up and down stairs, walking, squatting are painful and uncomfortable, or even just sitting through a movie, you've got patellofemoral pain syndrome. Why not get it taken care of now? Prevent it from turning into some arthritis or some bigger problems. Let us do a full evaluation on you, figure out what's going on, and get you set up for a good treatment plan to get the problem taken care of.